Hello everyone, today we're going to discuss regarding Bolen principles and whether it will stand the test of time and still be relevant in the future. This is the outline of our presentation for today. So in Malaysia in the recent years, the medical legal complaints received by the Kementerian Kesihatan Malaysia averages around 4 to 5 cases per week. However, in 2021, it drops to about 3 cases per week, but this does not reflect our litigation trend. So this is shown in this graph. So since 2017 to 2021, the cases have doubled up in only 5 years from 40 to 80 cases. So the increasing trend of the litigation for medical negligence conforms with the trend all around the world. So why is this happening? It may be attributed to few factors, among others are increasing awareness and knowledge regarding diseases, medical field, medical treatment and procedures. Hence, the society are more prone to sue doctors for anything that they perceive as mistakes, wrongdoing, and negligence. Over the years, the government had spent millions of ringgit for ex gratia and litigation for medical legal cases. In 10 years, 50 million have been paid for ex gratia and 139 million paid in litigation, bringing up to a total of 189 million spent for medical legal cases. This reflects the rising value of medical legal claims and compensation awarded by judges in these cases. So Bolen principle is based on a case tried in the 1957. Since then, it is used to determine the standard of care demanded of a medical professional. So Bolen was a psychiatric patient advised for ECT as part of his treatment. He signed a consent form but was not told about the risk of fractures that can happen from the treatment. So unfortunately, he suffered from several injuries. So he claimed that the doctor is negligent by not giving him muscle relaxant and failed to provide adequate physical restraint to prevent injury and also failed to warn him regarding the risk involved in the treatment. So the judge found that the doctor is not guilty of negligence as he acted in accordance to practice accepted as proper by a responsible body of medical men skilled in that particular area. So the risk of fracture said to be very slight, and it was a common practice that the doctors would not warn their patient of such risk. So Bolen failed to satisfy the court that if he was warned of the risk, he would not have undergone the treatment. So Judge McNair then, in his judgment, formulated a test now known as the Bolen principle. So the doctor will not be held negligent as long as 1. He acted according to an accepted medical practice, and 2. That the practice is accepted as proper by a responsible body of medical opinion, regardless of whether there is more than one accepted practice by other bodies of responsible medical opinion. So practically, it means that while the law imposes the duty of care, the standard of care owed by a doctor to a patient is left to the medical fraternity, as affirmed in the Sidaway case. So in the end, medical practitioners have the final say regarding whether negligence has occurred, but not the cause. In medical negligence cases, when the breach of duty of care is established, the doctor will be found negligent. So the duty of care is an indivisible duty. However, as for the medical negligence, it is further divided into duty of 1, that is to inform the patient of risk, thus comprises the informed consent. Second, the duty to diagnose, and third, the duty to treat. The same standard of care applied to all these 3 components.
So in this slide, we can see that the medicine is a science that which is constantly evolving. So therefore, it is very vast as well. So as the time goes by, we can see that from the original problem, and then we have something that comes out from the Bolito case, which is modified Bolem. And in the recent years, we can see the rejection of Bolem in all aspects, as well as the rejection of Bolem in some aspect. And further down the line, we also have Roger Whittaker's, which is the test is restricted only to the duty to advise and the risk involved. The volume is 1957, yeah, versus Friar Hospital Management Committee in 1950s. Subsequently, we have also cases which apply Bolam in the treatment and diagnosis, which is Chinkyo and Swami in 1960s. However, along the line, we can see that in the 1980s in Australia, F versus R, suddenly there's also rejection of Bolam in the disclosure of information ready. And then we have the next one we have in 1990s, Rogers versus Whittaker, which is one of the main landmark case that we will discuss later, whereby they rejected Bolam in disclosing material risk as well. And further down the line, we can have another landmark case, which is in the 1990s, Bolito versus City and Hackney Health Authority in 1997, which they interpret the Boehm's test. And further down the line, into year 2007, in Malaysia, we have the landmark case, which is Fu Fiona versus Dr. Su Fok Moon in Malaysia, whereby they totally reject Boehm test in the disclosure of information. And nearing to us, in the recent years, we also have Montgomery case and Zuhasnima case in 2015, whereby both rejected Boehm in the disclosure of information. And however, in the Zuhasnima case, they retain Boehm's test in the diagnosis and treatment.
Since the introduction of Boehm in 1957, many UK cases has been affirming the Boehm test. Example of cases that applied Boehm include Sidaway versus Governors of the Bethlehem Royal Hospital in 1985 and Maynard versus West Midlands Regional Health Authority in 1985. In Sidaway versus Governors of the Bethlehem Royal Hospital, the judge in that case stated that the law imposes duty of care, but the standard of care is a matter of medical judgment. In Maynard, Lord Scarman also stated that the courts may prefer one opinion over another, but that is not the basis to conclude negligence. Since then, Malaysia has also been affirming Boehm tests in medical negligence cases. These are some of the Malaysian cases that applied Boehm test prior to Roger Whittaker's case. But I would like to focus on two cases that use Boehm test but somehow have some variation in its application, which is the case of Elizabeth Chu and Khao Nam Singh. In the case of Elizabeth Chu versus Government of Malaysia in 1970, this case is concerned with negligence in medical diagnosis. What happened was the patient sustained complication during colonoscopy and had to undergo emergency surgery. The complication was not diagnosed during procedure because the patient was under general anesthesia. There were divergent in medical opinion whether colonoscopy should be done under general anesthesia or sedation. But in applying Boehm test, the judge decided there were no negligence in this case. However, the reasoning stated in this case laid down the foundation for future case, namely Khao Nam Singh. Raja Azlan Shah said that, to say the least, I am no advocate of the right of medical men occupying a position of privilege. They stand in a position as any other man. Their acts cannot be free from restraint. Where they are wrongfully exercised by commission or default, it becomes the duty of the courts to intervene. Here you can see that the court started to exert its power in terms of setting the standard of care based on common sense or logical reasoning to come to a decision. Khao Nam Singh is an interesting case in terms of application of Boehm test. Even before Roger Whittaker's case in Australia, Malaysian court has not applied Boehm test in its totality. This case concerns with negligent medical treatment. What happened was the patient developed complication following application of complete plaster cast. Although there were divergences in opinion among medical experts, by applying Boehm test, the judge decided that there were no negligence in the choice of treatment, meaning applying plaster cast versus applying back slab. However, for the two other allegations, the judge decided that the doctors failed to skillfully apply the plaster and failed to give post-op treatment when complication arises. The decision for these two allegations were not based on medical expert opinion. However, it was based on circumstantial evidence and logical reasoning, quoting, even a layman could appreciate the correlation between injury and the cast applied. There were various interpretations of this, whether it affirms Boehm or rejects Boehm. Some interpreted it to reject Boehm, and this is an important case where it was further referred in the famous Fu Fiona case, in which Boehm test was rejected.
Medical expert opinion plays a vital role in determination of doctors' liability as part of the Boehm principle. In Hux versus Cole in 1995, the UK judiciary have changed and adopted a pragmatic approach and held that it was appropriate for the judge to reject medical expert evidence if they do not stand up to analysis. However, only a minority followed such approach. The major change came 2 years later with the decision of Bolito versus City and Hackney Health Authority in 1997. So in this case, Patrick was a 2-year-old boy with stroke who had 2 respiratory episodes where he went pale with noisy breathing. So the doctor was notified but failed to attend him. Following each episode, Patrick was well and jumping around. However, half an hour after the second episode, he suffered respiratory failure and went into cardiac arrest. He was revived but with severe brain damage and later on died. So the mother sued for negligence, stating that Patrick would have survived if he was intubated. So in this case, the doctor was established as being negligent for not coming to see Patrick. But to establish causation, the judge decided regarding the decision for intubation or not. So there was opposing opinion of medical expert, but he did not think that the testimony of the other expert, even though opposing, was not unreasonable or even illogical. Therefore, he could not dismiss them. So for the question of causation, it was not established. The catastrophe that occurred to Patrick was not caused by the breach of duty. What happened in Bolito case was, the Judge Lord Brown Wilkinson reinterpreted the word responsible used by Judge McNair in Bolam. He said that the court has to be satisfied that the exponent of the body of opinion relied on can demonstrate that such opinion has a logical basis. So if it can be demonstrated that the medical expert opinion is not capable of withstanding logical analysis, the judge is entitled to hold that the body of opinion is not responsible. Even though there exists a body of professional opinion sanctioning the defendant's conduct, he can still be held negligent if it cannot be demonstrated to the judge's satisfaction that the opinion relied on is reasonable or responsible. Bolam had been reinterpreted, but that it was rejected in some aspect of duty of care. Such prominent case was Rogers versus Whittaker in 1993. This case rejected Bolam in duty of disclosure and informed consent. So Mrs. Whittaker was nearly blind in her right eye since the age of 9. So at the age of 47, after a routine eye checkup, she was referred to a doctor for possible surgery. Dr. Rogers advised her that he could operate on her right eye to remove scar tissue, improve its appearance, and possibly restore significant sight to that eye. So after the operation, there was no improvement in the right eye, and she developed inflammation and sympathetic ophthalmia in her good left eye, which led to complete loss of sight in the left eye, thus left her with almost total blindness. The doctor had not advised her of this risk, which can occur in 1 in 14,000 chance. So the High Court rejected the Bolam test for duty to warn of risk, saying that a doctor has a duty to warn a patient of a material risk inherent in the proposed treatment. So a risk is material if, in the circumstances of a particular case, a reasonable person in the patient's position if one of the risks would be likely to attach significant weight, or if the medical practitioner is or should reasonably be aware that the particular patient if one of the risks would be likely to attach significant weight. So if according to Bolam, medical opinions determines whether the risk should or should not be disclosed, and it doesn't matter if the patient asks questions, making it futile for the patient to ask questions. If the Australian High Court had followed the Bolam principle, the surgeon would not have been held responsible for the failure to warn. The High Court disapproved of the principle stated in Bolam. Using the judgment in Rogers versus Whittaker as a test, the court will decide upon evaluating the evidence adduced, that is, the court will have the final say, whereas when using the Bolam test, the court will defer to the opinion of medical profession. So this is also known as the reasonable patient prudence test. Malaysia also applied Roger versus Whittaker. So in this case, it was claimed that the respondent had negligently caused Dominic death by failing to diagnose and treat a spinal injury. This case was dismissed and was then appealed. It was dismissed again due to it was merely a theory that the deceased had suffered from spinal injury and was not established by any evidence. So in Dominic, the Rogers versus Whittaker test was applied in relation to the claim of a misdiagnosis and wrongful treatment. On the principle of stare decisis, the court has applied the full Fiona test and rejected the Bolam test. Another case is the case of Dr. Ismail Abdullah and Po Hui Lin. In this case, it was claimed that the doctor failed to inform the patient of the risk of complication after the surgery. The doctor claimed that the patient had been advised on and consented to the operation. The session court did not hold the defendant liable of negligence when treating the patient, but liable in failure to advise the risk. So the defendant then appealed. So in the High Court, it was allowed to appeal as the first defendant could rely on the defense of therapeutic privilege in not warning the patient of any material risk in the operation, as warning her would result her in refusing a life-saving treatment. So Rogers versus Whittaker test was applied and the judge reversed the decision. So Rogers reaffirmed the therapeutic privileges. It outweighed any duty to warn of any material risk. In this case, Bolam test was not applied.
So this is a case of Fu Fiona versus Dr. Su Fok Moon, year 2007. So some facts regarding this case is that the appellant in 11th of July 1982, she had an accident with her companion near the Asunta Hospital, and there she was admitted. Subsequently, she was treated 3 times non-operative method with traction. However, the treatment was failed. So therefore, the doctor had performed operation to surgically open the back of the neck and to move the dislocated vertebrae and securing it with the bone graft, and the loop of wire was inserted to stabilize the spinal cord. However, after the operation, unfortunately, the procedure failed and she became paralyzed. And it was found that the wire loop that was inserted to secure the spinal cord was the cause of the total paralysis. And second operation was scheduled to remove the wire loop. However, it did not remove the paralysis. So therefore, the patient informed that if she was being told regarding the risk of paralysis from the operation, she might not consent to it. So in this case, the federal court restored the order of High Court on the grounds that the doctor was negligent on 3 counts. Number 1, which is failure to warn the risk of paralysis to the patient prior to the operation. And number 2, to perform the first open neck surgery without exercising due care and skill. And number 3, to fail to take a immediate remedial step to rectify the paralysis. So therefore, the trial judge analyzed all the evidence before him before making a decision instead of using Boehm's test, which is to rely on medical expert alone. So therefore, the discussion in the court that time was that the ultimate consideration has to be whether or not the doctor had acted reasonably and logically. So therefore, in this case, Boehm's test has no relevance to the duty and standard of care of the medical practitioner in providing advice to the patient and to give proper informed consent in regards of the material risk of the treatment. Therefore, the federal court in this case rejected Boehm and instead applied the Roger-Whittaker test. So the issue involved regarding the risk and whether the appellant was one of such risks for her spinal injury after the operation was the main issue. And she also mentioned that if she had warned regarding the risk, she might not readily to be agreed to undergo the first operation itself. So therefore, conclusion from the case is that in Malaysia, doctors must inform the patient with sound of mind and who is able to understand all the material risk in the proposed treatment before obtaining the consent for the operation.
So why was Boehm was replaced by Rogers? Boehm was thought to restrict court from scrutinizing and evaluating the conduct of medical profession because the test determined negligence solely on the basis of medical opinion. As long as there is one body of medical opinion that agree with the doctor's practice, then the doctors can exculpate himself or herself from the allegation. Therefore, it is seen as a bit too overprotective of the medical fraternity. Another reason why Boehm is replaced is because it is not compatible with standard of reasonably competent doctors. which this standard could only be achieved if the courts were given the authority to determine the final outcome by taking into account all of the presented evidence as well as the opinion by the expert witness. But since the application of Rogers and Whittaker's in Fufiona case, Malaysian courts has been inconsistent in the application of Bolam test. Some cases were decided based on Bolam, while others totally reject Bolam. Fortunately, all of this confusion, whether to apply Bolam or Rogers, was clarified in the decision of Zul Hasnimar case. So Zul Hasnimar versus Dr. Kupu Velumani in 2017. It's a case of medical negligence with regards to diagnosis and treatment. This is a case where a patient who is 36 weeks pregnant collapsed in the ward and required urgent cesarean section. The outcome was the patient survived, but the baby had suffered severe brain damage and maimed for life. So the main question for which the leave is sought is whether Bolam or Rogers should apply in medical negligence case. Whether the appellant was indeed in labour upon presentation and required early caesarean section that could prevent the whole ordeal, or whether there was adequate resuscitation upon collapse. So there were divergence of medical opinions during the trial, but when Bolam test was applied with Bolito qualifier, the trial judge found that the expert opinion of the respondent were reasonably explained and the case was supported by good evidence. Therefore, there were no negligence were found from all three allegations. This case is important. It has been described as a landmark case because the case clarified what test to use in the case of medical negligence. So, for duty to diagnose and treat, Bolam Bolito will be applied, while for duty to inform or disclose risk, the Roger Whittaker's test will apply. So far we have touched on cases that applied Bolam and reject Bolam. However, in those Malaysian cases that did not apply Bolam, they did not expressly stated in the decision or reasoning that Bolam is no longer applied in all aspects of standard of care. However, in the case of Nazakis versus Western General Hospital in the High Court Australia, the court explicitly stated that Bolam should no longer be applied in medical negligence case. Nazakis versus Western General Hospital in 1999 is a case that concerns negligence in diagnosis and treatment. The doctors were found guilty of failure to consider alternative diagnosis, failure to conduct angiogram, and discharging patient without considering other diagnoses. In this particular case, the judge extended the principle of Rogers versus Whittaker's in relation to duty to advise into the realm of diagnosis and treatment. The court says that expert opinion should not be determinative whether the defendant is negligent or not, because such evidence can come from collegial sympathy or professional courtesy. Therefore, the courts clearly state that court is the only, the sole arbiter in deciding whether negligence has indeed occurred.
So here we are, we're finally at the final part of our presentation, which is the discussion. So what do you think, Najmi? Do you think Bolam will be still relevant in the future?
No, I think Bolam will be used in its original form anymore. However, Bolam Bolito or the modified Bolam, like what we know now, will still be relevant in the future. However, Roger Whittaker's is more widely used and appealing to the patient now as we are moving toward a patient-centered care. So, we might see a change in the future.
I agree with you, Najmi. So from the trend that we have seen so far, Bolam is in its original form is becoming obsolete at this point of time, and it doesn't seem that it can stand alone to be used as test, as the medicine is a very vast and it is case by case basis. So at the same time, the Bolam's test can also be overprotective of the medical fraternity, so that we are now living in the society where the doctors are not more regarded as the most important person or the most knowledgeable person. So the doctors also don't get the same respect like we did before. So therefore, if the test like Bolam is still being used, it can be seems to overprotect the doctors from any medical litigation. Therefore, this can create some mistrust among the public towards the judiciary system and the medical profession itself. Furthermore, there's a need of check and balance so that the doctors cannot just do whatever they want as long as there's a medical opinion that can support them and agree with what they are doing. And not to mention that now we have patient autonomy, which must be protected. So if you use Bolam, the patient autonomy might be not protected.
But guys, do you really think Bolam and Bolito will still stand the test of time?
Yes, I think so. This is because the evidence from the expert opinion will still be very influential in terms of the diagnosis and treatment, provided it is deemed reasonable by the court. So the expert opinion rule cannot be totally disregarded because like what has been stated in the Zul Hasnima case, that the court cannot resolve a dispute that it is not equipped to resolve. So the judges are expert in the law but not in the medical sciences. So they need the expert opinion to guide them in forming a just judgment. So, what's more, our public are more legally aware, so any information can be accessed and searched on the internet. They will need the doctor to explain more, and the doctors need to address the question and tailor the treatment to their need and answer all their queries. So, this is the patient-centered approach that we are heading to. So, therefore, Bolam alone will not be relevant anymore, but Bolito will cater the shortfall of Bolam. However, it must be noted that in some area of duty of care, Rogers versus Whittaker's test will be more suitable.
I beg to differ. I think even Bolam, Bolito or modified Bolam will not be relevant in the future. Bolam was first introduced in 1957 and slightly more than 40 years after that, the Australian court in the case of Nasakis totally reject Bolam in all aspects of duty of care. So we are highly influenced by other courts, especially courts from Commonwealth countries. We already adopted Rogers Whittaker test in duty to inform and advise. So it won't be too far-fetched to say that this principle will be extended to the realm of diagnosis and treatment as well.
But Amira, do you know that after the Nazaki's case, Australia had an indemnity crisis that led to medical legislation reintroducing the Bolam in its modified form?
Yes, I'm aware of that, but the power that courts hold to set the medical standard in medical negligence case cannot be underestimated, because the statement from Judge Gopal Sriram in the case Dr. Su Fuk Moon versus Fu Fiona worries me that there will be a complete shift from medical profession setting their own medical standard to judiciary that will set the standard. What he said was, there may perhaps come a time when we will be compelled to lower the intervention threshold if there is continuing slides in medical standards, but that day has not yet come. So the sliding in medical standards could be a matter of perception or a matter of reality, because social media nowadays has been a major influence in the perception of public. A lot of stories and news are discussed in the social media platform, and some has been embellished and sensationalized to gain more attention from the readers. So the judges are not inoculated from this influence from the social media. So this misperception or perception could create mistrust towards the medical profession. So people will think that can we really let doctors set their own standard when there has been too many mistakes made. Although as a medical profession myself, it is very hard to admit that from my personal observation that there might be some decline in the standard of care over the years. This might be attributed to lack of knowledge and experience, especially among the junior doctors, because the system as if now their training has been significantly, the training time has been significantly shortened for a variety of reasons. So I'm afraid that they will come.
To summarize what we have discussed today, we must remember that medicine is a science that is constantly evolving. And in the recent years, we have been adopting patient-centered care. The disclosure of risks which concern the individual autonomy of the patient, that is, meaning to make an informed consent and should be given more information and knowledge to the patient. Even though the standard of care should be determined by the medical professional with the same specialization, but this does not mean that the medical profession have the free rein to decide the standard of care for diagnosis and treatment at their absolute discretion. The Boehm's test, as we mentioned before, cannot be used as standalone test. Therefore, at the end of the day, the Boehm's test must still satisfy an additional test that can withstand analogical logical analysis and common sense, which again can fall under purview of the courts. Nonetheless, both the body of medical professional and the courts have their own role to play and need to work together in tandem with each other in order to ensure the best quality of medical care given by the medical practitioner and also serve as check and balance over the medical profession to ensure patients' rights are always protected. Thank you.